Hello, welcome to our evidence-based practice nursing project. The title of our EBP project is Negative Pressure Wound Therapy, Bridging the Gap Between Research and Clinical Practice. The research team consisted of Brandon Bly, Jenna Creamer, and Linda Venturado, and we all did a clinical on 5 East, a special surgery floor at UCMC. As we started clinical on 5 East, we all noted the discrepancy in the types of wound therapy being prescribed for patients. This led us to the clinical practice issue of which was the more effective type of wound therapy for wound healing. There were two main types, the standard by tradition, which was wet to dry, or wet to moist dressing changes, in which they were manually packed and debrided in order for wound healing. Now research is suggesting negative pressure wound therapy, in which an occlusive dressing device is hooked up to a pressure system in order to heal the wound. Research is saying this is the most effective type of wound healing at this point. This clinical practice issue is extremely important for our patients because we know the overall goal of wound therapy is to return tissue integrity in the least amount of time with the least amount of complications. When using a negative pressure wound therapy system over the standard wet to dry or wet to moist dressing changes, we see that the occlusive dressing with negative pressure closes off the wound from the environment and causes a smaller amount of time that the wound is exposed to the environment. Therefore, it decreases the risk of infection when doing dressing changes, decreases the chance of a secondary amputation that will happen, decreases the overall pain experience that the patient goes through because of the fewer dressing changes, decreases the amount of time that wound therapy will be going on, and overall you will just have a happier patient with this chosen type of wound therapy. This clinical issue is also extremely important to nurses because it allows us to employ patient-centered care because negative pressure wound therapy right now is evidence-based practice in wound therapy. In order to guide our research, we developed a PICO question. Our chosen PICO question was, in patients receiving wound therapy, what is the effect of negative pressure wound therapy in comparison to standard wound therapy on effective wound healing? The search for evidence was completed using the databases provided through the University of Cincinnati Library. The main database we used was the Cumulative Index to Nursing and Allied Health Literature, commonly known as CINHAL. When searching for articles, we used keywords such as negative pressure wound therapy, vacuum-assisted closure, wound healing, and other keywords like conventional wound therapy, moist to wound dressing, wound care, comparison, comparative studies, and randomized controlled trials. We limit it to the English language, full-text PDFs, peer-reviewed scholarly journal articles, and published in the last 8 years. Our group found 4 quantitative experimental research articles for our project. 3 of those articles were randomized controlled trials. 2 were level 1 high quality and 1 was a level 1 good quality randomized controlled trial articles. The other was a level 2 high quality quasi-experimental study. Overall, our articles showed strong, compelling evidence and consistent results providing a solid indication for a practice change. Therefore, our practice recommendation on wound therapy is for more often, patients be considered for negative pressure wound therapy for the most effective type of wound healing. This will lead to positive outcomes and decreased time, pain, amputation, and complete wound closure and wound healing. Thank you for listening to our evidence-based practice nursing project.